The vertebral column is composed of a series of bones that protect the spinal cord, but the vertebral column does much more than that. It supports the weight of our skull. There are many muscle attachment sites on the vertebral column for things like our posture, for breathing, and some of the movements of our body. And the vertebral column has sites where ribs attach to form our thoracic cage. So we'll look at all of that, starting with the basic curvatures of the vertebral column. These spinal curvatures have names that should sound familiar because, based on our early study of anatomical terminology, we know that cervical refers to the neck, thoracic refers to the thoracic region, lumbar is the lower back, and the sacral region is below that. You have probably also heard of lumbar support that some office chairs will have to support the lower back. So we have curves for each of those four regions, and we can see that there are 5 sections of the vertebral column. Some of these are using the same names we just saw: cervical, thoracic, lumbar, and sacral. But then there is a small little bit of bone at the very inferior end of the vertebral column, and that is the coccygeal region, meaning that's the region of the coccyx, which we call your tailbone. We'll see that at the very end of this video. We'll revisit the coccyx. But what you can also see here is that the vertebral column is formed from vertebrae. So, how many vertebrae are in each of these regions? Well, if you're a parent of young kids, I've got great news for you. 7, 12, and 5 is probably roughly your meal times. Like, for sure, with my young kids, 7 o'clock is breakfast time, 12 o'clock we have lunch so we can get naps going, and 5 o'clock-ish will be dinner time. If you're a youngster with no kids, I recognize those are probably way off your daily schedule. But 7, 12, 5 is the number of cervical vertebrae, thoracic vertebrae, and lumbar vertebrae. Then the sacrum in the sacral region is composed of about 5 fused vertebrae. In the tailbone, the coccyx is also fused vertebrae, somewhere between 3 and 5. Now, those curvatures can be modified, sometimes due to disease or trauma, but sometimes due to things like pregnancy. So, for example, lordosis, this exaggerated lumbar curve, can occur during pregnancy. Kyphosis results in this hunchbacked appearance due to this exaggerated thoracic curve. And scoliosis is a lateral curvature. So when the spine is shifted to one side or the other. Often that happens in the thoracic region. Often this is a congenital thing that you might have been born with. My bro has some minor scoliosis, and it's one of those things, like my cat's heart murmur, that the docs keep an eye on, but so far everybody's healthy despite those minor defects. I don't like cats. I had that cat as a kid. Okay, let's look at some vertebrae a little more closely. So, some basic vertebral anatomy is that they have a big weight-bearing region called the body, and they have a very sharp, sticky-outy part that you can actually feel if you run your fingers down your spine. Those sharp little bumps are called spinous processes. Coming out the sides of the vertebrae are transverse processes. So remember, transverse means across. They have a hole in the middle called the vertebral foramen, which just means the hole of the vertebra. And that's where your spinal cord runs through the bone. And the last two on these series of images is there's a little region here called the pedicle. I always think of this as like the pedestal. You know, if you have a trophy or something, you set it down on the base, and then there's the pedestals that come up the side. So if you orient your vertebra like this with the body at the bottom. The pedicles are little columns or cylinders of bone separating the body from all this stuff above it. And last is lamina. Lamina is like a thin layer or sheet. So not the spinous process, not the pointy nose of the vertebrae, but just behind that is the lamina. Now we should also point out again that there are these three types of vertebrae: cervical, thoracic, and lumbar. And then the sacrum and coccyx, those are all fused, so you won't get those confused. But let's look at these three types of vertebrae. And I've put small arrows at the regions of the vertebrae that you really want to focus your attention on. For example, cervical vertebrae have a very small body because they're not bearing much weight, usually just the weight of your skull. They also have a bifid or bifurcated spinous process. So see how it is shaped like a V here. Only cervical vertebrae look like that because only cervical vertebrae have a nerve running in between the bones in that region. Those are fine, but there's one characteristic of cervical vertebrae that's the most important and the most obvious. There are these two holes in the cervical vertebrae called transverse foramina. And these holes are in the transverse processes. Remember, transverse is across, so these chunks of bone that stick out the sides are here and here. All the vertebrae have these chunks that stick out the sides, but only cervical vertebrae have holes through those processes. So, thoracic vertebrae, their body is medium size, and then they have these kind of like little horns sticking up out of the top. They're very smooth and they face forward, and a very long and pointy spinous process. And really, you're just trying to make sure you can tell thoracic and lumbar apart, because cervical has a lot of ways to tell it apart. But thoracic, we're just comparing again this body, and now look at the body of the lumbar vertebrae, much larger. These little horns up top are very different looking in lumbar vertebrae, where they're much more bulky and curved inward. And the spinous process on a thoracic vertebrae is long and sharp. On a lumbar is chunky and dull. Or, as a lot of people will say, thoracic vertebrae look like giraffes. They have their big ears out the side, transverse processes, but then they have their horns sticking out up the top. Whereas lumbar vertebrae have this big bulky nose, spinous process, and then these kind of flappy, it's like almost like their big flappy loose lips that they use to suck up swamp grass. I'm from New Hampshire, so we got hella moose. So just kind of take a peek at those, and in lab you'll be seeing these again, learning how to tell these types of vertebrae apart. So now let's stack up some vertebrae, because our goal here is to understand the entire vertebral column. So to get oriented, here are these spinous processes running down the midline of the vertebrae. And we talked about how the vertebrae have these regions up on top that are kind of like horns or antlers. So what are these things called? Well, the whole chunk of bone that sticks up above the vertebra is called a superior articular process. It means the above chunk of bone that will articulate with something. And articulation is just a joint. So the superior articular process is where the vertebra is reaching up and trying to join up with the other vertebra that's stacked above. But if you look at a vertebra somewhere in the middle of your spine, you'll realize, of course, that there's a vertebra above it and below it. So each vertebra will not just have superior articular processes, but also inferior articular processes, so that you can stack the vertebrae on top of each other. There's just one little nuanced thing to understand about these processes. A process is like a bulky chunk of bone, but the vertebrae really only touch at one specific spot. It's kind of like, look at my hand. If you give me a high five, you're not touching my whole hand. You're just touching my palm or this face of my hand, right? So my hand is the process, the big chunk of bone. But just the region that you touch is called a facet. The superior articular facet is a little cartilaginous protected region of the process. And then the vertebrae will come together like this. They'll touch facets. Another thing to notice is if you look at the vertebral column from the side, you'll be able to see that there are these little holes. And I'm not talking about the hole running up and down for the spinal cord that we saw in a previous picture, the vertebral foramen. This is like when you stack up these vertebrae. Can you see my eye still? There's a hole like this running transverse across the vertebral column. This will make more sense, I think, when we realize that it's all good if you can run a spinal cord down from your brain to your tailbone. But unless you only want to send messages to the bottom part of your body, you really need to let the spinal cord send out some branches out to your arms and your chest and your abdomen to tell those parts of the body what to do and to let signals come in. So the spinal cord can't be trapped in bone all the way down. There have to be little holes in the vertebral column so that nerves can come out and come in. Yeah, signals go out and signals come in. So intervertebral foramen means that in between the vertebrae, there are holes so nerves can come out. And then finally, you have these intervertebral discs shown here. Remember from when we studied tissues that any type of cartilage that resists compression is fibrocartilage. So these discs, these intervertebral discs have fibrocartilage, and you can have herniated discs, or they might be called bulge discs or slipped discs or ruptured discs. And that happens most often in the lumbar region of your spine. It can happen from one single excessive strain or injury, or over time things can develop. And the problem with these is that herniated disc can push on the nerves we just mentioned that are escaping from the vertebral column and cause pain signals to fire and go to your brain. Okay, most of what you see on here are terms we've already talked about, but these are two very special vertebrae called the atlas and the axis. And the other name for these are C1 and C2, because the atlas is the first cervical vertebra, C1, and the axis is the second cervical vertebra, or C2. They're going to look a little different from the other cervical vertebrae because their job is to support the skull. The good news is that they still have the one most important characteristic of cervical vertebrae, and that is the transverse foramina. These little holes that only the cervical vertebrae have. So that's great. It's also great that these two look very different from each other and from the other cervical vertebrae. Like the atlas, we mentioned a few videos back, is named after that mythological being that supports the weight of the whole earth. So has to hold the earth with cupped hands like this. So the atlas has these rounded cup shaped superior articular processes. And the skull, more specifically the occipital condyles, the occipital bone, rest on the atlas. And when you rock your head, yes, the skull is rocking in those superior articular processes. So keep an eye out for that kind of shape. That is atlas. Axis is a cervical vertebra that has this big chunk of bone sticking out the top. It's called the dens. And think of dens meaning tooth, like dental or dentist. Or, if you want to get fancy, the other name is odontoid process. Oid, O-I-D, means shaped like. And odont is like orthodontist. It means tooth again. So whatever you want to call it, dens or the odontoid process, it's like a tooth-shaped and tooth-sized chunk of bone sticking up out of the top of the axis, and it'll help you recognize that bone. Its job is to articulate with the atlas. You can see the dens sticking up from below, and when you swivel your head or rotate it from side to side, you're rotating on that dens. So between the atlas and the axis, you have a lot of support for movements of the head. Here's just a few more slides looking at the details of the thoracic and lumbar vertebrae. What you see here, there's a few terms with boxes around them. And the reason is these structures are involved in supporting our rib cage. Each of these terms have the word costal in it, and costal means rib. So you can see that there is a superior costal facet and an inferior costal facet. And there's a transverse costal facet for the tubercle of the rib. So we'll see this on a later slide. But basically you've got 3 places on each thoracic vertebra where ribs will attach. And they all have the name costal because costal means rib. Lumbar vertebrae are down in your lower back. There's no ribs down there, so there's nothing fancy. All the terms you see here we talked about as basic structures that all vertebrae have. They just look a little bit different on these big, bulky lumbar vertebrae. Okay, we're down to the sacrum and the coccyx. So here is the sacrum made of 5 fused vertebrae. You could still see some of the remnants of those vertebrae. Like you see the spinous processes sticking out. But because those are all fused, they have a new name called the median sacral crest. There is a sacral canal to allow some nervous tissue through. That's at the superior portion of the sacrum. And there's a ridge of bone at the top of the sacrum called the sacral promontory. The sacrum is kind of shaped like a mountain, meaning it's got a wide part and then it comes to a point. And just like a mountain, the wide part will be called the base. So it's the superior region that we call the base. And the inferior region is called the apex. You got to kind of get used to that. There's lots of organs and bones in your body where the base is at the top. Even the heart has a wider region at the top. So the base of the heart is actually superior. So it's like an upside down mountain. We also have some sacral foramina. You can see the holes here. But I also added an image showing the nerves that are running through the foramina. So you can try to remember that all of these holes that we're naming have pretty critical functions inside your body. And then the coccyx, 3 to 5 fused vertebrae, also known as the tailbone, found in the coccygeal region of the vertebral column.